Could someone call a doctor? Let me patch you up. I am Dr. Angela Ziegler, at your service. But most people call me Mercy. I understand you just returned from an Overwatch mission. And from what I understand, you ran into, Talon. Is that correct? Interesting. And your optic nerves, they've been giving you issues. Okay. Let me guess, you ran into a master hacker. Sombra. She can be quite the handful. I'm sorry that you seem to be in some discomfort. Though, if you'll permit, and are not in too much pain. Because again, I'm here to help. I do have to ask some pertinent questions to make sure I don't have to test for anything else. Messing with Talon is no laughing matter. Though it is good to see that someone actually needs my help. How to put this delicately? Usually people come to me even if they have the slightest of paper cuts. They scream for healing, healing, healing. Let me tell you, sounds more like they need a ambulance rather than a medic. So I'm happy to be of service to someone who clearly needs my help. That's right, the questions. Is it alright if I let you stew a bit? If you're in too much pain, we can get quickly started with the medical exam. Wonderful. Let me go get my clipboard. Alright, I know you cannot give the specifics about your mission. Very hush hush, top secret. Understood. But, can you give me a possible general location? Like Ilios perhaps, somewhere in the desert, somewhere cold, like Canada. It's just so I can know exactly what to check for. Any dehydration or cold limbs, a cold, a chill. Any of those things. Understood. Junkertown, how fascinating. From what I've heard, there's some quite unsavory folks that call that place home. Alright, and Talon, yes? Talon? Everything out there is quite in turmoil within their inner ranks. But from what I understand, you ran into Sombra. Okay, Sombra. Master hacker. Though right now I think she's a bit more of a free agent. Still, nasty piece of work, that one. And, do you perhaps remember anyone else that you ran into? Like who? Well, certain Talon members can have a nasty streak. Some like to rely on poisons, like a certain Widowmaker. Ooh la la. No Widowmaker, that's good, so I do not have to check for any poisons. Negative. Alright, and perhaps did you get burned at all? Well, certain members of Talon, not naming names, but a large man going by the name of Marga. He has a proclivity for setting people on fire using his giant miniguns. So do you have any singes, any burns? No. Good. Alright. And besides the general wear and tear of the hacking, any other cuts, bruises? Not to your knowledge. Good. Now, please answer me this. Are your optics, are they connected to your nerves at all? Okay, no, that's good. What about any other senses that you have enhanced? Like, is it connected to your ears to give you enhanced hearing? Okay, so we might need to check that as well. From what I understand, Sombra leaves no stone unturned. She's quite thorough like that. Okay. We'll check that as well. No poisons, no burns, just the optic nerves. And can you see me all right now? Kind of. Okay. Well, I will do what I can, seeing as this is both a medical issue and a technical issue. Though once I'm done here with you, you should really go get yourself checked out by our mechanic, so to speak, Torbjorn. I can definitely escort you to his workshop. Oh, it is my pleasure. You do a lot for our community after all. Well, no time like the present. Let's get you all patched up. I'm here with you. All right. Where to start? Would you mind if I gently pressed around your ocular nerves? This kind of socket area. Just to make sure that there's nothing inflamed. I also might need to take your temperature to make sure that nothing is influencing something that it shouldn't. Wonderful. Now tell me, when's the last time you got your optics checked? It's been a couple months. Were you on a mission long? It's alright again. Hush, I understand. Though you should know better. Your health takes full precedent over the mission. I know not everyone sees the way I do, but I take caring for people quite seriously. As we all know, heroes never die. At least on my watch. Right. I'm going to approach you now. Please let me know if you do not feel anything at all, or if you feel any pain. Right. Just gonna gently come over here and gently press along your eyes. Do you feel that? Good. All right. Okay. I don't feel any inflammation, any redness, not that I can see. Okay, now you're doing such an excellent job. Alright. No pain. Good. Can you hear me alright? Okay. A little bit of hard of hearing, to be expected if she hacked you when you do have some enhanced hearing. Okay. Right. And can you explain to me the issue? What exactly are you seeing on your end? Are you seeing multiple of me? Am I fractured? Do I appear to be skipping in time? Sometimes? Okay. What about repeating of myself? Okay. Interesting. Any static? Okay. Right. What about any colors? Are you seeing colors correctly? Good. Okay. We'll have to double check all of this. But no pain, that is good. Again, no redness, no swelling, no swelling. Okay. To me it sounds like she put a nasty virus inside your optic nerves. Well, let's see what I can do to ease your pain. First, may I take your temperature just to make sure? And again, you don't feel any tingling sensation anywhere else. Understood. Okay, that's good. That's good. Alright. Right. If you could just hold still for me. I'm just gonna quick take your temperature. And I know you said you didn't run into any poisons or anything. But you don't feel any shortness of breath or anything. Any dizziness. Good. Okay. It's a little high. Something might be overheating in there. Let's see. Alright. Let me get you all hooked up. Pardon me. Alright, I'm just gonna take this and plug it in. Hold still. Right. Okay. And how's that? Good, good still so far. Good. Alright, let me see over here. Can you not hear me? Am I? Can you hear me? No. One moment. Can you hear me now? Good, I apologize. It seems like I tripped something up. Let me make sure that all these things are connected. Okay. Let's just... Okay. Tell me when you... How is that? Still a bit muddled. Okay. How about that? Still a bit muddled. Okay. Right. Let's see what this does. How's that? Getting better. Has the skipping stopped? Good. And how do I appear? Okay, let's do a few visual tests. You can still hear me all right? Wonderful. Okay. Now, how many of me do you see? Just the one. Good. Alright. Now, if I can just have you follow my finger as it gets closer and farther away, if you could just focus, okay? Just gonna watch how your pupils dilate. Good. Okay. Let's try the other side, and I'm gonna get closer and farther away, and closer and farther away. Good. Alright, and you can focus right here. Perfect. Right. I'm just going to move my finger until it's out of your vision, alright? Wonderful. Don't strain. Are your optics picking up anything unusual? Still a bit fuzzy. Okay. Alright. Now, I'm going to hold up some fingers and you just tell me how much I'm holding up, okay? Wonderful. And how many fingers? 2. Alright. And how many? Good, alright. And how many? Good. How many? 6. Okay. Very good. And good. Alright. Next, let's run through some colours. Okay. I'm going to flip through some colours and you just tell me exactly what colour you see, alright? Good, alright. And is the hookup still acting alright? You don't feel any pain, any pinching? What about when you focus? Do you notice any pain? No, good. Oh, maybe something I've done is helping a little bit. It's a positive sign. Alright. Let me know if that changes at any given point. Alright. Are you ready for the colour test? Perfect. Alright. Now we're just going to begin and you just tell me exactly what you see, alright? Perfect. Good, 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 good. Alright. Okay. This colour. Good, 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 good. Last one. Perfect. Alright, let me just turn that off. Seems like you are looking at colours properly. No any extra interface or noise. Perfect. What about any headaches? Have you been experiencing any of those? A little bit when you're concentrating. Okay, okay. Let's see what I can do. Right. How about that? No. Okay. Okay. What if I just unplug? Plug it back in. About the same. Okay. Okay. How's that? It's a bit better. Good. Now, if you'd be so kind as to let me check some of your other special optics, like infrared. Okay. Everything okay? You can see me alright? Good. Alright, let me turn that off. Let's see. Alright. How about that? How's that? Bit clearer. Good. And again, and no pain. Perfect. Let's see. Let's just come over here and see what we can do. Okay. Let's check your ears. They might go in tandem. Whatever she put in you might be having issues with them interconnecting. Fixing one might help fix the other. Okay, let me go get the hearing test. And again, I apologize about turning off your hearing earlier. It's not my intention. You're such a wonderful patient. Alright, let me I'm going to put these on you really quick. And then we're going to have if you listen for sounds, whatever side it comes from, you're just going to raise your hand, or nod your head, or blink. Though right now, blinking might be a little bit of a difficulty for you. Whatever makes you comfortable. Alright. Okay. I'm just gonna gently put these on. How's that? Do you snug? Any pinching? No. Good. Alright. The test. You can still hear me okay? A little bit harder. Okay. That's to be expected. If you can't hear anything, just let me know. That's a negative sign. Right, the test is about to begin. Okay. Alright, how's that? Good. You passed all the tests. Though I think I finally figured out the issue. One ear sounded more muffled than the other. Correct. What a nasty hiding place for her to put such a nasty virus. I swear, Talon gets more vicious by the day. Alright, let's see what I can do about that. Okay, if you could just hold still, let me just quickly and gently come over here. See what I can do. Hold still. Again, I'm not a mechanic. I am a medic. But I think I see your issue, seeing as everything seems to be connected to the nerves. Okay. Alright, let me just take this cord and plug it into here. And take this cord and plug it here. And take this one and plug it into here. And press this, that, this, and this. No, okay, no. And good. And last finishing touch. Just, Can you see me? Wonderful. Oh, I'm so pleased. Still, even though I seem to have found the core root of the issue, you should still go see our friendly mechanic. Friendly might be a strong word. He's more likely to tell you that you should see his meatballs rather than give you any helpful advice. But he means well. Don't mention his height. That's a good tourbillon for you, and don't be concerned if you happen to run into his protege. No, I'm not speaking of his daughter, though she is lovely. I'm talking about the Omnic. Bastion, and I understand Omnics are sometimes a sensitive topic, but I promise you this one is lovely. Quite sweet, actually. They enjoy Legos. Now let me go and get this all written up, and then I will send you on your way. No dilly-dallying. Understood? Perfect. Alright, alright. Virus was incorporated into hearing module. Okay, got that done, Passed color test, infrared, hearing test. Next course of action should go see mechanic. Now you are not cleared for duty for at least 2 weeks. Have some time to settle and also have some time for yourself. Self-care is some of the most important care that you can do for yourself. And do not let any of the other Overwatch members tell you differently. They all overwork themselves. I swear, the amount of times I've had to patch up both Genji and Reinhardt would make your head spin. Speaking of those two, please tell me that they are not your usual members. I'm surprised you haven't come in with anything worse. It means you must be very good at whatever you do on the battlefield. They'll get some strong words from me, though. Maybe I can have you keep them in line instead of charging off and then asking for heals. I am very pleased to know that you've come back safely. Now, remember what I said. No dilly-dallying. Go straight to Torbjorn. I'm your doctor. What I say goes. So, off with you. And if anything else gives you any trouble, or if you notice any unnecessary side effects, come straight here, and I'll patch you up. Off with you. And welcome to Overwatch. I hope people are nice to them. It's a hard battlefield out there, but if they ever need heals, they can come straight to me.